Good morning, everybody. It's great to see so many people out here already, and also I heard that there's a lot of people with us online, so welcome to everybody virtual as well. My name is Jesper Andersen, and I'm from the University of Copenhagen, and I'm one of the co-chairs. And Lipika.
Hi, everyone. It's so nice to see everyone after 2 years of doing this remotely, to finally all be together. Thank you for everyone who made the effort to come. And I hear there are more than 900 people registered online, so welcome to our entire virtual community. It's fantastic to be all together again. My name is Lipika Goyal. I'm a medical oncologist at Massachusetts General Hospital, and a woman who needs no introduction is Stacie, Lindsey, our CEO and founder of the Cholangiocarcinoma Foundation. She's here to kick us off for this wonderful conference.
Good morning and welcome. We're so grateful you're here with us in Salt Lake City. It's been a long 2 years, and we're excited to see so many familiar faces. And we want to welcome especially those who are brand new to this community and newly diagnosed. We know this can be a fearful time, but we are here to support you and help you in every way that we can. I want to give just a few housekeeping items. The virtual platform is available to all of you in the audience and to the virtual attendees, so you can participate in the trivia, you can participate in the surveys, you can connect and chat with other attendees through that platform. So you can also see the agenda and speaker biographies on the platform as well. We'd like to thank our sponsors whose support made this event possible. You can see all of them up on the slide. We're so grateful that so many of them are able to be here with us, and that they're so interested to hear the patient stories and to connect with you personally. And we just can't thank them enough for making this conference possible. Today is Wear Green Day. For me, it's kind of an everyday thing, but thank you for everyone who's participating. If you will share your photos with us in the photo gallery online, there are chances to win prizes. Be sure to participate in the trivia. Prizes are awarded randomly for that as well. The CCF store is right across the hall here. There's all kinds of t-shirts and swag and things that you can purchase if you would like. Be sure to check the agenda regularly. We have a lot of updates every day usually, so we want to make sure that that you know exactly what the agenda is. Surveys and testimonials. So every day there'll be a new survey for patients and caregivers on the virtual platform. It's really important. They're short, but it's really important if you can, especially the patients and caregivers, can answer these surveys. This really helps us to design the conference around your needs and to answer some critical questions as we move forward and work on programs and projects that support you. If you want to share your story, we'd love for you to share your story, but if you'd like to share your story, you can go to the platform and click on the Testimonials tab, fill out the form, and share your connection to cholangiocarcinoma. Hearing from you and learning how you're connected to the foundation really gives hope to the entire community. There's a CCF booth outside that you'll see, and it's virtual, and then there's also a booth right out front where you can get connected to any of the resources that the foundation has so that we can help you. Lunch will be served directly across the hall in room 250. Am I pointing in the right direction? In room 250. Sorry. In room 250. Glad I checked. And then be sure to also visit the patient lounge, which is 253A and B, right? Patient lounge, okay. Patient lounge is this way. The awareness store is this way. So please feel free. The patient lounge is specifically for the patients. It's a very restful area, comfortable seats. You can visit and just have a nice time. And thank you to the Fleischers who have made that such a nice area for the patients this year. Okay, with that, we're gonna get started. So, can you pull up my slides? Nope. That's slides for the patient day. That's the slides for the volunteers. Well, I'll just tell you, I'm going to do something a little different this year. I'm going to share with you some of the broader programming and things that we're working on this year at the foundation. You can see my personal story, our family's personal story. There's a video on it that we'll be showing during the conference, and also you can see that on the website. And most of the specifics of a lot of the programs that we're doing, the volunteer program, the research advocacy program, specifics on the ICRN, the research network that we work with. All of those kinds of things and specifics will be in different talks, and I'm going to do a little more high level, share with you some of our goals and the bigger projects that we're working on in just a minute. Just a couple of things to share with you while we're waiting. And I talked with the patients about this last night and today. Today is the patient day, so this day is specifically designed with programming for you in mind. And you should feel free to ask questions. There are several of the scientists and researchers here that will be happy to talk with you. Again, we would just remind you, I would also remind our virtual viewers that they can send their questions in, and we will ask those of those who are presenting if they have questions or comments they'd like to make. Also, would like to remind you to please keep your questions general so that they can be answered in a general way. Dr. Goyal is amazing, but she hasn't seen your blood work, she hasn't seen your slides, she hasn't seen anything, so she's not going to be able to answer personal questions about your personal treatment, right? Okay. And so you're going to see in the next 2 days some of the most amazing scientists and clinicians here, and we're so grateful to be involved with them, and we just want to be sure that we thank them for the work that they're doing. They're working so hard on your behalf, and also so grateful for our sponsors who are doing the same. Okay. Can I go to the next slide? Okay. So we have been working for the last couple of years on our strategic plan. Now, you might wonder why in a general meeting like this I'm presenting a part of our general plan. We have to make sure at the foundation that we have feedback from all of the stakeholders in this space. So that's the scientists, that's the clinicians, that's industry partners, it's patients and caregivers, it's regulatory bodies. We want to make sure that the direction we're going and the things that we are doing are the things that the whole community, I think, are going to get us to where we want to go. And where do we want to go? A cure. We are all in agreement that that's where we want to be, but there are some steps that have to be taken to get us there. So you can see our mission statement at the top: to support patients and render cholangiocarcinoma a treatable disease. And just to tell you, there are a lot of models out there. One of the best models is multiple myeloma, and many of you know Kathy Giusti, who's been a great pioneer, who suffered from that cancer when there were no treatments. She had a pharmaceutical background, and she knew some things that needed to be done to make this happen, and she made it happen. And multiple myeloma, for the most part, is now it's considered a chronic disease. So going from no treatments in a 10 to 15-year period to multiple treatments and multiple treatments coming down the pipeline is an amazing feat. And we want cholangiocarcinoma to be cured. That's the end game of all of this. But one of those steps, or the next step before we get there, is to have treatments available for patients. So you can see that at the top. And then there are two pillars: improving the patient experience, which is supporting the patients, and cure, which is delivering breakthroughs. And then on the bottom, you see there's operating as a world-class organization. This is a global organization. We are collaborating widely and globally with every foundation who supports cholangiocarcinoma and all other research networks that are supporting cholangiocarcinoma. We're all working together. Whenever one of those pops up, we try to engage with them as quickly as we can. In the middle, you can see our core values: patients first, collaboration, innovation, and urgency. We won't work with any companies or any organizations that don't share those same values with us. It's very important to us, and it's important to us that we protect the interests of the patients always. You can go to the next slide. So just to talk about the patient experience, there is no detail in this. This is a very high level, but educating and empowering the patients is one of the most important things that we do. And that includes advocating for the patients, expanding access to treatments, elevating the patient voice, and developing and disseminating comprehensive data. That's the kind of data that we're talking about, where you have entered your data into the patient registry, and we can give back to you de-identified aggregate information so that you know how many patients in your state have the same diagnosis that you have, or those kinds of things. So that's the kind of outputs that we're working on. You can go to the next slide. So cure, prioritizing and accelerating cholangiocarcinoma research. This is one of the things that's been the most important to the Scientific and Medical Advisory Board, that we support young, innovative, high-risk, high-reward research, because no one else in this space is doing it, and it's very hard to get grants. It's hard to make progress in a disease when there is not research funding available. And so that's a big priority for us, growing and supporting the global cholangiocarcinoma scientific and clinical field, and supporting the research and development pipeline. And I'm going to talk a little bit more about that later. So you can go to the next slide. So operating as a world-class organization is recruiting, retaining, training staff, board members, volunteers, so that they can interact in a global way, and in an efficient and streamlined way. Developing and tracking outcomes. We're working on a lot of things. We want to be able to report the good work that we're doing, so that you know, and that we can work together on the things that are the most important. Clearly communicating our work, and then identifying engaging funders. If we want to fund research, we have to get the funding, and that's a priority for us. You can go to the next. So it's important for you to know that in the middle of all of this, that patients are the heart of everything that we do. You are the most important part of this, of all of the programs that we're doing. We're not doing it because we want to work. We want to not work. We want to cure for you, and we want to do something else. But until that happens, we're going to be here, and we're going to get this work done. You can go to the next one. So I want to talk with you a little bit about advocacy, and I wanted to talk just generally about what advocacy is and what advocacy isn't, because as an advocacy group, we are a nonprofit and we're doing a lot, but the core of what we're doing is advocacy. And so when you are a patient, especially newly diagnosed patients, they usually don't know just a ton about the disease. And I mean, it's hard to say cholangiocarcinoma, but to really understand a very difficult disease takes a lot of time and training. Patients are focused on their self-care because they're in treatment, and their family. Their main concern is personal, their personal treatment pathway, and their emotions play a significant role in their decision-making. When they move into becoming an advocate, they have more in-depth knowledge about the disease and more training. Their focus is on the wider disease community. Their main concern is influencing research and healthcare delivery, and their emotions are channeled into community objectives. So let me give you a few more. You can go to the next slide. So patient priorities, and we know this from multiple surveys that we've done, are what clinical trials are available, and and can I be included? Nutrition, mental health, and financial toxicity. You can go to the next one. Patient advocate priorities. Patient advocates are usually patients and caregivers. And so those priorities, those previous priorities don't go away, but you have additional priorities, which are communication of research or whatever the programmatic things that we're working on, participation, and validation that your input is important in the process. You can go to the next slide. So there's a gap between a patient and caregiver and becoming an advocate. And we're trying to build the bridge, build a bridge so that patients and caregivers can feel comfortable getting there. Now, some patients and caregivers, as soon as they're diagnosed, they run across that bridge. They want to engage, and they want, right now, they want as much information. What can I do? How can I do it? Some take a very careful, paced walk across that bridge and end up an advocate, and some never get there. Every single one of those is okay. Every patient is different, and they all handle it different, and that's totally okay, because if you don't ever want to be an advocate, we will help you. We will do that work for you. So you can go to the next slide. So what really are the goals of advocacy? So advocacy is not about being politically correct. It's not about making everyone feel good because patients have been invited to the table, and it's not about checking a box. Advocacy is translating research faster and more effectively because you've had patient input. It's getting better answers more quickly. It's communicating progress clearly back to our constituency, and it's involving the patient perspective in the entire process, the whole process. You can go to the next slide. So advocacy organizations have taken on a different role, I would say, in the last 5-6 years, where they have moved from allowing patients to have a seat at the table to needing patients at the table. Advocacy organizations have become very different. They're strategic. They have strong research and technical expertise. They're primary educators and trusted communicators, skilled messaging, extensive reach to their community, and the ability to empower and activate constituencies. So the advocacy organizations are becoming very sophisticated, and I think that a lot of our pharma partners are realizing that and understanding that if we want patients to get access to treatments, we have to work together. You can go to the next slide. So this is just an overview of the advocacy landscape. If you look at the green, the primary goal to support and educate patients, their families, and friends. That's support. Second is research advocacy. Now, Melinda is a research advocate, and I'll tell you a little bit later about our research advocacy program. But the research advocates, they interact with the research community, and that means industry, the scientists, the clinicians, and provide patient perspective to the research process. So that's helping with protocols, helping with patient education materials. There's all kinds of things that the research advocates are helping with. If you look at the primary goal, then you have fundraising advocacy, or fundraising so that we can do more research. And then, if you can go to the next slide, then you see that orange piece right there. That's the political and public policy. Now, this is a tricky one for us. The other three we're pretty deeply engaged with. Political and public policy is a place we're just dipping our toe in. And what I mean by that is that takes a lot of money. It takes a lot of strategy, it takes a lot of time, it takes a lot of heft to be able to influence Congress, to influence the NCI, the DOD, these places where there are large pockets of money. But advocacy groups have had, larger advocacy groups, PAN-CAN, some of these other groups, Longevity, some of the bigger advocacy groups have had a lot of success carving out large chunks of money out of those organizations because of this public policy advocacy. That's not an area, we're just dabbling right now, but we are looking at that to see what we can do to get more funds into the research. You can go to the next one. So I don't think this statement is a surprise to anyone, but better patient outcomes start with better patient engagement, and that's what advocacy is all about. We want better outcomes for the patients, and so do the partners who are working with us from industry. And they'd like to know probably sooner than later if something is not working, so we can move to the next option. Let's go to the next slide. It's all about the patients. Go to the next slide. Okay, so COVID, like I said earlier, was hard. It was hard on a lot of us. We saw people we loved pass away, get very sick. We've been isolated. It's been a rough couple of years, but it was a pretty great year for cholangiocarcinoma. And part of that is because we had our first 3 in the last years, our first 3 FDA approvals. We're so grateful for these companies for hanging in there. It's hard work to do in these rare indications, and we're really excited for this, and we hope to see a lot more. You can go to the next slide. So I want to talk about a little bit more about the drug pipeline. And I want to talk about this because this is the work that advocates do, that research advocates do, and this is the work that we've been involved in for the last 6 or 7 years. And there are 2 ways that we work with companies. We reach out when we see an adjacent disease that has a biomarker or some kind of indication that tells us that might be of interest to cholangiocarcinoma. And we talk with them about adding a cohort, a group, into their clinical trial of cholangiocarcinoma patients. And the other thing that we do then is when we go to AACR and some of these other more scientific conferences, or if our members of our scientific board say, hey, we see something interesting here, we'll talk with the companies, and then we'll connect them with labs that have cell lines that they need to do further work on to see if their drug will work for cholangiocarcinoma. So that's what we're doing on the front end. So you see that there's these 5 parts of this drug pipeline. You can go to the next one. And we decided what we would do is we would map out what we could do in each of those areas, because when we came into this area, there was not even a standard of care 15 years ago. So in 2010, we got GemCis, and we've had that standard of care for a long time, but it's not good enough. I don't think anyone in this room feels like it's good enough. And so we had to find a way to attract more companies to develop drugs in this space. And how do you do that with a rare indication, with a small group of patients? And so we got to work, and these are some of the things we do, and I'll take you through it just a little bit, so you can go to the next slide. So in the discovery and preclinical phase, what we're hoping is that some of the companies that are here will start to support this community through research fellowships, some of the young investigators to help them to look at different kinds of options for patients, mentorships for young scientists. They're interested in the natural history and patient data. Well, where does that come from? If a company wants to come into the space, they need to see the information that you put into the patient registry. They want to see how this disease develops over time. And that's how they do. They can't see your personal information, but they see the aggregate information. And that helps them to see, are there enough patients? Are we going to be able to do our work that we need to do in this space? Translational science tools, patient and provider education about new research. Patient and ICRN. ICRN is the International Cholangiocarcinoma Research Network. It's long, so we call it ICRN. But it's this group of clinicians and scientists who are collaborating widely across the United States. Advisory boards and insights that they can give to companies, studies, design studies, unmet needs, and then data for comparison. So then we move to phase 1. You can go to the next slide, sorry. So patient education about participation in phase 1 trials. So if you are a cholangiocarcinoma patient, and I think Melinda would tell you this as well, pretty important that you understand what a phase 1 trial is and what you'll have access to and what you'll be able to, that there are some drugs, newer drugs coming out, and the only way that you can get access to them is through a clinical trial. And if you're a cholangiocarcinoma patient, part of your treatment journey is probably going to be a clinical trial. And so educating about what options are available. And then we often have the companies come and share information and share about the different kinds of options that are available as well. So advisory boards on study design, inclusion and exclusion criteria. The companies need to know what the patients would or would not accept in a clinical trial. Well, how are they going to find that out? They're going to find out from patients. And they're also going to find out from clinicians who are going to share patient experiences with them and give their opinion. And so we help to set these up with the companies so that they can get the information they need to move forward, move along this pipeline. Provider education, and then assistance and meetings with the FDA, which we've done many times. Can go to the next. So then if a drug passes that, it moves down the pipeline into phase 2 and 3. Again, you have accrual to clinical trials. And we don't, I probably would hesitate to say recruitment or accrual because it really is about education. We always want to respect the rights of the patients. Any patient, we want to have access to a clinical trial if they want to participate in a clinical trial. But we feel like it's important that every patient have all the information that they need so they can make an educated decision. Support for patients in trials. And we can work with the companies on a lot of options there. Patient stories and insights, all of those things. Then we move to the next phase. You can move to the next slide. So CCF has participated in several FDA interactions and meetings. And you can see all the different regulatory insight, visibility in the cholangiocarcinoma community. When there's approval, lots of webinars, lots of question and answer sessions. We want you to feel comfortable if you decide to go on a clinical trial that you have all the information that you need. And then you can move to phase 4. Next slide. Again, visibility in the patient community, and that's patient-friendly clinical trial information on the website that you can understand. You know, sometimes when you go into your appointment and they give you a consent form that's this big and all kinds of paperwork and stuff, it's written tiny, it's a little hard to understand, so we're trying to help you with that. But also education and outreach to providers about new therapies, often in the community setting, and then sharing of the data and the results. All of these kinds of things are things that we're working on. So you can move to the next slide. Okay, so this is like the drug pipeline, and these companies move down this pipeline. And you can see on the end then we've had those three approvals. Very exciting, and we hope that as more companies come into this space and develop drugs, and we want them to be good drugs, that we can get more approvals, and that's what we see on the horizon. You can go to the next slide. So I just wanted to show you, we keep very careful track of the interactions that we have with these companies, and so this was our first approval ever from Insight. This is the timeline that we started working with them in 2017, and you can see the kind of interactions that we were having with them, right? They were identifying, went out to a meeting with them, identifying the patient experience, mapped out some projects, patient advisory board that they had in early 2018, an ad board in 2018. We helped them in late 2018 with a resource on molecular profiling or biomarkers. You can go to the next. And you can just see just all through the year, all of these interactions as they're doing patient surveys, as they're meeting with them when they're at the bigger meetings, ASCO, things like that, sharing patient and caregiver testimonials, all very important. And there's like 3 more pages, but we won't do that, so we'll go to the next. But each company that we work with, we keep track of this timeline so that we know the kinds of interactions that the companies are having with advocacy and the kind of impact that we're having on helping these good treatments for you become available. Okay, so who does all this work? The research advocates. And this is an amazing group of volunteers. These are all volunteers, and you can see their background there on the right-hand side. You have radiation oncologists and research nurses, and we have a software engineer, an AI specialist, technical writers, clinical research coordinators, but we have moms and dads and sisters and brothers. You can learn this. You don't have to learn the science, but you can learn how to give feedback and how to help us move things along if you have a desire. And so just wanted you to be aware of that. Melinda runs this program and she does an amazing job. And who doesn't want to spend more time with Melinda? Everyone does. And so you can go to the next slide. So I just wanted to say, when you work with a volunteer organization, I love this quote, start where you are, use what you have, and do what you can. That's what we did as a family, and that's what we are doing today. You may not have any background in biology or anything that's going to help you understand cholangiocarcinoma. Neither do I. I have a degree in psychology. But I have some good organizational skills. And that's where we are today. And everybody takes what they have and they add to where we are. And if you have skills and things that you think you might be interested in helping us move this along, please just talk with us. We're happy to help. And we're going to talk about volunteers in just a minute. You can go to the next slide. So this is an exciting one. It's another something that we just got the readout of kind of the preliminary data at GI ASCO. And this is the first kind of our first shot on goal at immunotherapy with cholangiocarcinoma. I guess we've had a lot of shots that didn't get to the goal. But this one looks pretty good, and we're excited to see Dr. O will be here today. She was the PI on this trial. We're going to hear from her. We're going to see what's going to happen. We're hoping to get more data soon so that we know how this is going to affect the population. And I think there'll be a lot of conversation about it in the next couple of days. So another one in the pipeline that's coming down. You can go to the next. I talked about I wanted to just share quickly a little bit about our trusted partners. We put a program together. I would say there was a need for us to really think very carefully about who we partnered with as we became bigger and as more companies were approaching us, and a variety of companies. And so we had to sit down and think about internally what our core values were to work with, to have trusted partners. And I mean trusted partners as far as other advocacy organizations, but also for-profit partnerships. And so those are the 5 values that we, besides our core values for the foundation, but these are our trusted partner values, that we have core value alignment, right, which is collaboration, patients first, collaboration, innovation, and urgency. That we have a relationship of trust, that there's quality work, they're doing quality work, that we have complementary strengths. We're not interested in competing. We really want to work with companies that have complementary strengths to us, and that we share a passion for you. You can go to the next one. So this is a group of foundations across the world who are working on cholangiocarcinoma. You see down there in the small right-hand corner is the Japanese Cholangiocarcinoma Association, and they came to us about a year ago and asked if we would help them. And so Melinda and I are on the phone with them once a month, every month, sharing everything we have. Every foundation who wants to support cholangiocarcinoma can have access to every single thing we have. We want these patients to do well wherever they are. Okay, next slide. And these are our trusted for-profit partners. These are not our industry partners on our industry council, who are all trusted partners as well, but these are our for-profit partners. And these are about data mostly, and communications, and one is a platform, Oncolens is a platform that we use for tumor boards. So we're thrilled to work with both our advocacy partners and our for-profit partners. We feel like we have the best of the best, and that's important to us. You can go to the next slide. I'm not going to say a lot about the ICRN because Dr. Nilo Azad and Dr. Mitesh Borad are going to talk with you, but I think it's really an important program of the foundation is the ICRN working with ENSCA and with other organizations around the world who are trying to organize and work together and collaborate together So ENSCA is the European. Jesper is a member of ENSCA. The ICRN is a lot of clinicians and a bunch of scientists. ENSCA is a bunch of scientists and a group of clinicians. But we have such good complementary things going on. We work together on a mentoring program. We have a webinar series for professionals, a newsletter, quarterly meetings, shared data. This is really impactful because this is work that has to be done globally. And we're really committed to doing what we can to ensure that we can help make that happen. And so you'll hear more about that later on Thursday or Friday. You can go to the next slide. So just invite you to get engaged in any way that you feel comfortable. We welcome you with open arms. And again, we're really excited to have you here. So thank you for being here. And please feel free to come and introduce yourself to me. If you have, even if you've met me, please tell me your name. It's hard with the mask. but please come and introduce yourself to me. I'd love to meet you. And thank you for being here. Okay, and I'm going to do one more presentation for you, so you're going to be super tired of me after today. Okay, so I'm going to talk just a little bit about the volunteer program, and then I'm going to introduce you to the people who run that, and they're going to share some awards and different things in a minute, so you can go to the next slide. Okay, so I'm going to share with you just a little bit about the CCF Volunteer Community. This is a group of generous, kind, and passionate people who are serious about making a difference. Volunteers are important to every single program of the foundation. We simply could not do this work without volunteers. So I'm going to introduce you to a few of the volunteers and some of the amazing things they're doing. And in surveying our current volunteers, we have about 100 active volunteers, probably about a little more than that. They had a few things. There were 3 common themes throughout their responses to what's positive in volunteering. So you can go to the next slide. So volunteering turns isolation into community, and we heard that at the patient gathering last night and this morning, is that it is very isolating to get this diagnosis, but just knowing that somebody else could understand you is really important, and being able to help others who are in need is the same. Kelly, could you grab me some Kleenex, please? Thank you. Next slide. A rare diagnosis tends to create again, isolation and loneliness, but when you can change a loss of purpose into self-worth, that's important, and volunteering is shown to be able to help do that. You can go to the next slide. Okay. Volunteering also invites you to join a new family and a new community. And we hope that's what you feel here. We hope you feel that regardless of your health status, where you are in your treatment journey, that you know you're a part of a community. And we want to try and take some of that anxiety and fear away. And we know that knowledge and education does that. And that's what we're here to do, is help educate you so that you can make good decisions. Next slide. So I'm going to introduce you to a few of our current volunteers. This is Kay Free. She's a mentor with the Cholangio Connect program. She has enjoyed getting to know new people, and mentoring has become more than just donating her time. She's gained a lot of new friends doing it. Kay and her friends are now part of this larger caregiver community, which has helped her not feel isolated. Next slide. This is Amelia. She's a research advocate and shared with us how meaningful her volunteer experiences have been and how it's helped her identify new purpose in her work. She's found a lot of happiness knowing that she's helping others who've suffered from this disease. Next slide. This is Caitlin. Caitlin's a research advocate and a wellness program volunteer. She said that in February 20th of 2021 was the 6th anniversary of her mother's passing from cholangiocarcinoma. Caitlin said working with CCF has helped her to move forward with her grief, especially when working on the new wellness program. She said it's brought so much joy to her life. After 6 years, she's finally getting back to art and feeling good about it. Next slide. So based on the results of a recent patient journey and life impact survey, we know that most patients are suffering from a significant amount of anxiety and depression. This is understandable and expected, but what you might not be aware of is the significant body of research showing that volunteer work regularly improves the health of patients with chronic or serious illnesses. You can see all the references on the bottom. Well, you probably can't see them, but there are a lot of references on the bottom. To summarize, from several published studies, the health benefits of volunteerism include, but are not limited to the following: increased and improved mood, self-esteem, ability to cope with stress, feelings of control and sleep quality, while decreasing stress, depression, anxiety, fatigue, pain, and risk of disease. You can move to slide number 9. This is Gavin. Gavin started volunteering for CCF in 2008 after his dad was diagnosed. He said back then there were not a lot of places where people could find out important, safe, and relevant information about medication and treatment options, clinical trials, and side effects. But having the information on the website and the discussion boards was invaluable to me. People were there to help me, and I want to be able to help others too if I can. Next slide. So I want to share with you just some statistics from, I hope you can see those, some statistics from the volunteers. 2021 was a huge year of growth for us, and I think everybody their statistics went down a little bit in 2020 with the onset of COVID. So you can see that active volunteers were up 60% from 2020. Time donated increased by 48%. And these statistics are reflective, right, of the onset of the pandemic again, but just show the resilience of this community. The Cholangio Connect program also saw significant growth compared to 2020 with a 58% increase in connections. So those are mentor-mentee relationships, 58% increase in 2021. That's significant. A special thanks to the patient and caregiver mentors who've been so supportive to those who have needed your help during this time. CCF launched an updated newly diagnosed program, and with that came a video series of patient voices and caregiver voices, which were also introduced. In 2021, volunteers were asked to submit the number of hours they served. So 99 volunteers submitted their hours, which added up to almost 7,000 hours of service given in 2021. However, we know there are many volunteers that do not submit hours of service. For instance, Jesper and Lipika, who have spent hours and hours and hours preparing this conference for you, working on the agenda, inviting speakers, all of those kinds of things, and we're so grateful for their service. Many volunteers do not submit hours, but go about very quietly supporting patients, raising money for research, and spreading awareness through social media and other avenues. We just want you to know that we see you and that we are grateful for all of the work that you do. You might be wondering why we ask volunteers to tell us how much time they're spending serving. Oftentimes when we apply for grants, we're asked how many volunteers work with CCF and how much time is spent in service. These grants are important and help us to support and build more programming that's important to patients and for research. Next slide. Volunteers this year and last year created content that was featured on some of the Foundation's most highly viewed videos on our YouTube channel that had almost nearly 5,000 views. Some long-term survivor stories that were shared on social media reached audiences of more than 18,000. So their hope for newly diagnosed patients and their families is so important, and many times they find that on social media. Next slide. So volunteer Facebook fundraisers over the last 4 years have raised almost $1 million. That's astounding to me. Hosting a birthday fundraiser, an awareness month fundraiser, an anniversary fundraiser, every single bit of this counts. And that's money that's going to help with fund these researchers and their work, their important work. The 2022, you can see on the right-hand side, the 2022 fundraising events just look so fun, and you're going to hear more about a couple of big ones that are happening. But some of the ones that have been going on and that happened in 22 was the Quack Out, A Matter of Hope, A Hike for Jill, Oktoberfest, Jingle for Janet. These are not professional fundraisers, but man, they act like it, and we love them. It's so great to have such passion behind these events and all the amazing things that they have been able to do. We want to give special thanks to all of the on-the-ground event hosts and volunteers for these events and all the time they give. It's a big deal to host an event, and so many of you are getting way out of your comfort zones and doing events to support the research. We just are so grateful. Fundraising through fitness, you can see those on the bottom. We did those for Moving for the Cure and the Turkey Trot, and you can see the significant increase in 2021. Very exciting, and thank you for that. You can move to the next slide. This is Nirma Patel. She's been a member of Team CCF for the past 5 years, and in case you don't know, Team CCF runs the athletic events, the marathons, the walking, golf events, those kinds of things. And if any of you want to be involved in any of those, whether you want to host your own event or you want to be involved in another event, you can see Meredith McGuffage. She runs the Team CCF, the store, and you can talk with her and she can get you connected. She's been a Team CCF member for the past 5 years. Nirma has been. She raises money for the foundation in memory of her mom. When COVID-19 shut down in-person events in 2020, Nirma and Team CCF worked together to host a virtual turkey trot. She knew she had to do something for others fighting cholangiocarcinoma, and with fundraising on her mind, she eventually found CCF, and she has found ways that she's comfortable with to give back. So she and her family planned a 5K race and designed t-shirts, and she hasn't stopped planning the yearly event since, including she got a company match. Combined with her fundraising events fund, she's raised more than $85,000. So pretty great, and isn't that the cutest picture of her family? You can go to the next slide. Thank you. In 2021, CCF celebrated its 15th anniversary. A volunteer-led anniversary steering committee was formed. It was chaired by Barbara DuPont, who was a board member, and by Kelly Giles, who's up front here. She's my sister. They did this to commemorate this milestone for the foundation, but they also set a goal that they wanted to raise $150,000 for research. So they were inspired to start working out a plan on how they can do that. And they had a committee that were put together, and some things just erupted from that committee. And one of them was the Journey of Hope, which was led by committee members Dave and Linda Fleischer, who are back here. And you can go to the next slide. And so you can see some of the things that Dave and Linda did here. He traveled 15,383 miles. He went to 48 states. It was amazing. I hope you followed. So many people were following on the blog, and it was so fun. And Dave is just an amazing ambassador for the foundation. They visited, and you may or may not know that their daughter, Sarah Bennett, who was a long-term volunteer for the foundation, who we just loved dearly. And she passed away a few years ago, and they did this in her honor. And they visited Sarah's friends around the country. They visited her doctors at different institutions that she went to. This was really, really inspiring, and Dave would be very happy to tell you all about it. Raise your hand there, Dave. So great. And the exciting thing is that he had over 170 donors that raised $105,000, and with some of the other events that the committee planned, they were able to raise the $150,000 for research. So very exciting, and thank you. You can go to the next slide. Another part of that was bidding for the cure, and Barbara has done an event every year in her community, and this was something that she helped put together, and the whole steering committee put together. This was our first time doing a virtual auction. It was exciting and really successful, and we're really thankful for this. We also had a giving tree, a virtual giving tree at the 2021 annual conference. Lots of things that the steering committee did. It was very successful. And so thank you, Kelly and Barbara. Really appreciate you leading that effort. You can go to the next slide. This is another, let's see. Sorry, this is a Team CCF volunteer, Jonathan Whiting. Jonathan's in the pool there on the right, and that's his wife. And he is training to swim the English Channel this summer. The English Channel, just in case you did not know, is 21 miles straight across, but because of the tides and currents, the swimming route is, you do it kind of like in an S pattern, which makes it 26 to 28 miles. It takes anywhere from 7 hours, I think that's for the professionals, to 27 hours to complete the swim. The water temperature is average about 58 degrees. Fewer than 2,000 solo swimmers have completed the swim, and only 1 in 10 who train complete the swim. The swimmer is not allowed to touch another human being while completing the route. Food has to be delivered on a long pole from an escort boat. This is a big lift. And so we are going to be following this. He's going to be, there's going to be daily blogs where you'll be able to see all of the things that he's doing. It's going to be really fun to watch him do this, and so we're supporting him, and you can see their cute family there. Next slide. I'm sorry, let me just say one more thing about Jonathan, because he said, I, as well as Lori, were happier than we had ever been until the day I took her to the doctor for the results of her biopsy. Lori inspired me by the way she inspired others. Upon her diagnosis, although we cried together, she was strong, and she was never afraid of her cancer. Her strength and attitude are the inspiration for my swim. She could not control the fact that she had cancer, and she stayed strong and positive through her entire journey. The thought of swimming across the English Channel is very scary, and I do have a choice, but my choice is to use Lori's inspiration to get me across the same way she handled her cancer journey. That's sweet. Okay, this is DeLorean Ostrom. He is running a marathon every month of the year in 2022 in honor of his wife, Mandy, and their family. They have 2 little girls. He wants to raise awareness and research funds. So you can see a little bit about their story there, and there's we'll have more online, but you can follow. It's called Racing for Hope. I know a lot of people dream about running a marathon. That has never, ever been a dream of mine. I don't, I know. But I so admire people who just have a desire to do amazing things to inspire others, and I love that this is going to be one of the events that we're supporting and looking towards, so we're excited for them. Next slide. So we are always in need of volunteers, Cholangio Connect mentors, research advocates, conference volunteers, support group moderators, administrative and social media volunteers are all needed. CCF's current team of research advocates, that slide that you saw before that had all the, we have about 25, 30 active research advocates. There's more work than they can do. And so they would love to have anyone who's interested join them. And the great thing is you get to spend time with Melinda. We will train you, and we will help you along the way. Next slide. I want to mention again that you don't have to have a scientific background to be an advocate. You just need to have a desire. And I love this quote. Too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all of which have the potential to turn a life around. And I think I hope that's what you're feeling here at the conference. I'm not going to run 1 marathon, and I'm not going to run 12. And you may not be willing to sit in a car for, 15,000 miles to raise awareness. But you can wrap your arms around someone, and you can listen on the phone for a few minutes, and you can share a smile and maybe a note. And every single bit of it is important.